More than 55 million people around the world are currently living with Alzheimer's disease or a related dementia. Every 3 seconds, somewhere on this planet, someone new crosses into this diagnosis. In the United States alone, more than 7 million people are living with Alzheimer's disease right now, and the majority of the families watching them were never clearly told what to expect. Not at each stage, not in plain language, not in a way that gave them the information they needed before they needed it. That changes with this video. There are 7 clinically defined stages of Alzheimer's disease. Every case progresses through them. Some people move through them quickly, some slowly, but the progression always moves in one direction. And each stage is distinct enough that understanding which stage someone is in changes everything. How you care for them, how you talk to them, what decisions need to happen now, and which window is still open. We are going through all 7 today. What is happening in the brain at each stage? What the person is experiencing? What the family and caregivers around them are going through, and what each stage means for the decisions that matter most. There are also things that can be done right now, regardless of which stage concerns you, that the peer-reviewed research says make a genuine difference. We will reach those at the end. Subscribe now if you want brain health information explained clearly, sourced from named, published research, and delivered without exaggeration. Help Dr. Mannu Jones reach the people who need this most. Let us start at Stage 1. Stage 1. No impairment. The silent beginning. This is the most misunderstood stage of Alzheimer's disease because from the outside and from the inside, it is completely invisible. In Stage 1, there are no symptoms. None. The person scores completely normally on every cognitive test available. Memory is intact. Thinking is clear. Personality and behavior are unchanged. A neurologist could assess them fully and find nothing of concern. And yet, for people who will eventually develop Alzheimer's disease, the biological process has already begun. Beta amyloid, the protein that accumulates in the brain in Alzheimer's disease, forming plaques that disrupt communication between neurons, begins accumulating silently in the years and decades before a single symptom appears. Research published in the New England Journal of Medicine established this precisely. In families with a genetic form of early-onset Alzheimer's, beta amyloid accumulation was measurable on brain imaging approximately 25 years before the expected age of symptom onset. 25 years. A person who is 42 years old today and will develop Alzheimer's symptoms at 67 is already in Stage 1 right now. The disease is building. They feel completely normal. Every test they take is normal. And the biology is already in motion. Do not let the absence of symptoms fool you into thinking Stage 1 is the absence of disease. Stage 1 is the disease, hiding. For yourself, if you are watching this because you are concerned about your own brain health with no current symptoms, Stage 1 is the stage where lifestyle intervention has its greatest power. The 2024 Lancet Commission identified 14 modifiable risk factors that influence whether and when Alzheimer's develops. Sleep quality, blood pressure management, physical activity, hearing health, social connection, these have their greatest biological impact in Stage 1, when the brain is still clearing amyloid, still compensating, still building the neural reserves that will matter later. We will return to this. For a loved one, if someone close to you has just received a diagnosis in Stage 3 or Stage 4, understand that their Stage 1 was decades ago. The diagnosis is not the beginning of the disease. It is a point much further along the road than the moment the disease actually started. Stage 1 is completely invisible to the person, to their family, to every test their doctor runs. But Stage 2 is where something changes, and it changes only for the person experiencing it. Stage 2. Very mild cognitive decline, the private fear. Something is different. The person knows it, nobody else does. In Stage 2, the cognitive changes are subtle enough that standard tests still show nothing abnormal. A neurologist performing a routine assessment would likely find no deficits. And yet the person themselves is experiencing something new and persistent. Names that used to come immediately now require a moment of deliberate effort. Words slip away briefly before returning. They walk into a room and the reason they came is gone before they can hold on to it. They misplace their keys more often than before. They lose the thread of a story they have told dozens of times. Nothing that would alarm a doctor. Nothing a spouse who is not paying close attention would consider significant. But the person knows. The difference between how their mind worked 5 years ago and how it works today is real to them, private and real. This is the loneliest stage of Alzheimer's disease, because what stage 2 produces, for people who are on the path toward Alzheimer's, is not just occasional forgetting. It is the awareness of forgetting in a way that feels qualitatively different from normal aging. There is an internal signal that does not feel like ordinary tiredness or distraction. It feels like something is different in a way they cannot fully name. And in many cases, they are correct. For yourself, if this resonates with you, if you are noticing something that others dismiss, but you feel certain about, take it seriously. Make an appointment. Ask specifically for a baseline MOCA cognitive assessment. You may be told everything is normal. That is possible and even likely, but it is worth documenting, worth tracking, and worth a conversation with a doctor who will listen rather than reassure. For a loved one, if someone you care about is describing a genuine concern about their memory, particularly with a quality of worry rather than casual complaint, listen carefully. Do not reassure them out of the conversation. Stage 2 is the stage most consistently dismissed by families. That dismissal, repeated, teaches the person that their experience is not worth reporting. That lesson will cost everyone in the stages that follow. The clinical reality of stage 2 is that it currently cannot be confirmed as early Alzheimer's through standard testing alone. Advanced imaging can detect amyloid burden, but is not yet routine clinical practice. The result is that people in stage 2 who are on the Alzheimer's path are typically told their concerns are normal aging, given reassurance, and sent home. For many, that reassurance is accurate. For others, years will pass before they learn it was not. If stage 2 is the private knowing, stage 3 is where the knowing becomes visible, to those closest to you and to a specialist looking carefully. This is the stage where the question stops being, "Am I imagining this?" and becomes, "What exactly is happening?" Stage 3, mild cognitive decline, the stage that gets dismissed. Stage 3 is the first stage that shows up on a cognitive test. A clinician performing a dedicated cognitive evaluation, not a routine checkup, but a focused and thorough assessment, will find measurable deficits. Word-finding problems become noticeable enough for others to observe. The person struggles to recall a name they definitely know. The pause before the word is longer than it should be, and sometimes the word does not come at all. They lose objects in places that make no logical sense, and cannot reliably retrace how they got there. Complex reading requires more effort and concentration than it used to. They get disoriented in new environments in a way that feels more severe than unfamiliarity explains. And they begin, often without fully realizing it, to avoid situations where these gaps might become visible. They decline invitations to social settings that would require managing complex conversation. They step back from tasks they would once have handled without hesitation. They let a family member speak for them in situations where they used to lead. The brain is compensating. The regions that are not yet damaged are working harder to cover for the regions that are. This is why stage 3 still looks, to casual observation, like normal aging, and why it is consistently dismissed by families and clinicians who are not specifically looking for it. Here is what is actually happening inside the brain at stage 3. The hippocampus, the brain's memory-forming center, and the region Alzheimer's attacks. First, and most severely, is losing volume in ways measurable on an MRI scan. The amyloid plaques that began forming in stage 1 are denser. Tau tangles, the second protein involved in Alzheimer's disease, which collapse the internal transport system of neurons, are beginning to form and spread. The biology of stage 3 is significantly more advanced than its symptoms suggest. The most important fact about stage 3 is this: the average time between a person first noticing stage 3 symptoms and receiving a formal diagnosis is 2 to 3 years. 2 to 3 years of continued biological progression. 2 to 3 years of decisions made without complete information. 2 to 3 years of a window that was open and unused. For yourself, if you recognize stage 3 in your own experience, not occasional forgetting, but a new and consistent pattern of difficulty, ask your doctor specifically for a comprehensive cognitive evaluation, a blood panel to rule out reversible causes, including B12 and thyroid, and a referral to a neurologist if results are inconclusive. You have the right to ask for these by name. For a loved one, accompany them to their next appointment and describe in specific terms what you have observed: dates, examples, patterns. Caregivers provide information at stage 3 that the person themselves often cannot, partly because anosognosia, the reduced awareness of one's own deficits, can begin emerging even at this stage. Stage 3 still looks, from the outside, mostly like normal aging. Stage 4 no longer does. This is where Alzheimer's disease stops being something only one person notices and becomes something the whole family has to face together. Stage 4. Moderate cognitive decline. The stage of diagnosis. Stage 4 is where most people receive a formal diagnosis of Alzheimer's disease. The deficits are now clear and consistent on clinical assessment. Managing finances has become genuinely difficult. Tracking accounts, paying bills accurately, following a budget. Planning a multi-step event is no longer manageable. Following a recipe they have made for decades requires help they never needed before. Significant personal history, events that should be readily accessible, may be gone or unreachable. They withdraw from challenging situations with increasing frequency, not because interest has disappeared, because they know those situations will expose what they are working hard to conceal. The social withdrawal of stage 4 is routinely mistaken for depression or introversion. It is neither. It is a person managing a disease that is becoming harder to manage alone. Personality changes emerge. A person who is sociable may become quieter and more cautious. A person who is independent may develop anxiety about being alone. A person who is decisive may become slow and hesitant. These are not character changes. They are neurological, the altered biochemistry of an Alzheimer's-affected brain expressing itself in how the person relates to the world. The person in stage 4 is still recognizably themselves. They still know who their family is. They can still hold a conversation, express preferences, and make some decisions independently. That functional capacity is real. Do not let that functional capacity mislead anyone into thinking there is time to wait. Stage 4 is the last stage during which the person can fully and meaningfully participate in decisions about their own future. Advanced directives, healthcare proxy designations, financial and legal arrangements, preferences about where they want to live as the disease progresses, whether to pursue clinical trials, who will serve as primary caregiver. These are not morbid conversations. They are among the most important acts of care a family can offer at stage 4, while the person's voice is still completely and unambiguously their own. For yourself, if you have received a stage 4 diagnosis, the most valuable thing you can do right now is not primarily medical. It is relational and administrative. Have the conversations. Write your preferences down clearly. Tell the people you love what you want and what you do not want. Do this while the words are fully yours. You are giving everyone years, including yourself, a gift that will matter more than almost anything else in the years ahead. For a loved one. Initiating these conversations at stage 4 is a gift, not a cruelty. The person needs you to be willing to have them before the window closes. Avoiding them out of discomfort does not protect them. It leaves everyone, including the person themselves, without the guidance they will urgently need. The clinical fact most families are not told about stage 4 is this: it is the longest stage. Most people with Alzheimer's disease spend between 2 and 10 years in stage 4. That is not a single crisis moment. It is years of daily life that require a fundamentally different kind of understanding and support than the stages that follow. Stage 4 is the stage of still recognizing family, still independent in some ways, still having real conversations. Stage 5 is the stage where the word still begins to get harder to use. Stage 5, moderately severe cognitive decline. The stage of need. In stage 5, the person can no longer manage daily life without consistent assistance from another person. They may not be able to recall their current address. They may not reliably know what day, month, or season it is. Choosing appropriate clothing for the weather requires guidance. The complex tasks that were still partially accessible in stage 4 are now out of reach. But there are things that remain in stage 5, and they are worth naming clearly, because families in this stage often focus on what has been lost and miss the significance of what is still present. The person in stage 5 still knows who they are. They know their own name. They still recognize the people closest to them in most circumstances. They can still speak and communicate, even if with more difficulty than before. They can still eat independently. They can still manage basic personal hygiene, though they need prompting, guidance, and supervision. These are not small things. They represent the intact resilience of a brain working under significant biological strain to preserve what it can. They deserve to be met with real presence, not managed from a distance. What stage 5 introduces for the first time in this progression is the requirement for another person to be consistently and reliably present in daily life. Not occasionally, every day. This is the stage where caregiving becomes a full, demanding, defining role, not supplementary to family life, but central to it, for yourself. If you are in stage 5, the things that still work matter. Every conversation you still have, every meal you still enjoy, every face you still recognize. These are real. They deserve the full presence of the people around you. You are still here. For a loved one, stage 5 is where caregiver burnout becomes a serious clinical risk. Not because caregivers are not capable or committed, but because stage 5 caregiving is genuinely one of the most demanding, sustained roles any person can take on. Identifying respite support, connecting with caregiver communities, and accepting help when it is offered is not weakness. It is the only sustainable way to provide good care over years rather than months. The most common failure in stage 5 caregiving is waiting until the caregiver themselves breaks down before asking for help. At stage 5, the hippocampus has typically lost between 20 and 30% of its volume, visible on brain imaging. Tau tangles have spread well beyond the hippocampus into regions governing personality, language, and executive function. The amyloid burden is extensive. The biological progression is continuing. In stage 5, the person still knows you. Stage 6 is the stage where that can no longer be guaranteed. And stage 6 is the hardest stage for every family. Stage 6, severe cognitive decline. The stage of ambiguous loss. Stage 6 is the stage most families describe as the hardest. Not because the physical symptoms are at their most severe. Stage 7 brings greater physical decline. But because stage 6 is where the relational reality of Alzheimer's becomes fully, undeniably present. The person may no longer reliably recognize their spouse. They may look at a face they have known for decades and feel nothing they can identify as recognition or connection. For the family member standing in that moment, it is one of the most disorienting experiences any person can go through. You are present. You are looking at someone who has known you your whole life, and they do not know you. This experience has a name in psychological literature: ambiguous loss, the grief of losing a person who is still physically alive. There is no funeral, no date on a calendar, no social ritual that marks or contains this kind of loss. The family member is grieving the relationship, the recognition, the mutual knowing, while the body of the person they love is still present, still in the room, still alive. And yet stage 6 does not take everything. People in stage 6 who cannot reliably recognize a family member's name will sometimes respond when they hear their voice. They calm when held gently. They respond to touch in ways that carry something recognizable as connection, not cognitive, but something older and more fundamental. The most ancient regions of the human brain, the ones that process safety versus threat, warmth versus cold, care versus neglect, are among the last to be affected by Alzheimer's. Something in the person knows they are not alone, even when almost everything else is gone. Music is the clearest example of this. People in stage 6, who can no longer complete a sentence, will sometimes mouth the words to a song from their youth when it plays. They may tap their hand to the rhythm. Their expression changes in a way that families describe as the person coming back briefly. Research confirms that musical memory is encoded in brain regions that Alzheimer's disease attacks significantly later than the regions governing language and autobiographical memory. This is not sentiment. It is documented neuroscience, and it has a direct practical application. Music is one of the most reliable ways to reach a person in stage 6 when language and recognition no longer work. Families who know this use it. Families who do not spend years searching for a connection that was available to them. Stage 6 introduces behavioral symptoms that are among the most difficult to manage. Sundowning, an increase in confusion, agitation, and distress in the late afternoon and evening. Wandering, the person, leaving their environment, often with a clear purpose in their own mind, trying to reach somewhere from their past that no longer exists as they remember it. Paranoia, the conviction that belongings are being taken, that people are not who they say they are. Resistance to necessary care. These are not personality traits. They are not stubbornness. They are neurological symptoms produced by a brain that has lost the ability to accurately interpret its environment. Understanding them as symptoms changes how caregivers respond, and that change in response changes the quality of the person's experience. Do not let the moments of apparent calm in stage 6 suggest that the disease has stabilized. Alzheimer's disease does not stabilize. The progression continues. For a loved one, stage 6 caregiving is a 24-hour role. No single person was built to sustain it alone indefinitely. If you are providing stage 6 care without a support structure, without respite, without others who share the weight, you are not being strong. You are depleting yourself in ways that will cost you. The person you love needs a caregiver who is intact. Protecting your own capacity is not selfish. It is the most responsible thing you can do for both of you. Stage 6 strips away the roles and relationships of a lifetime. Stage 7 is the final stage, and understanding it clearly before you reach it is one of the most important things any family can do. Stage 7. Very severe cognitive decline, the final stage. In Stage 7, the brain has lost its ability to coordinate most of the body's daily functions. Verbal communication is gone or nearly gone. The person may produce occasional sounds, a word, sometimes a fragment of speech, but sustained, meaningful communication is no longer possible. Movement is severely impaired. The person is confined to a bed or chair, unable to reposition themselves safely without full assistance. Every activity of daily living now requires complete involvement from another person. Eating, bathing, toileting, all require careful, skilled, patient care. And yet, even in Stage 7, something remains. People in Stage 7 still respond to the tone of a voice. A familiar voice speaking quietly will sometimes produce a visible change, a shift in expression, a subtle relaxation, even when the words carry no meaning. They still respond to touch. Gentle, consistent contact from someone who is present reaches something the disease has not yet fully silenced. They still respond to music, in many cases long after speech is gone. The most fundamental regions of the brain, those that process the basic experience of being cared for, of not being alone, are among the last to be reached by Alzheimer's disease. Being present in Stage 7 matters. It reaches something real that clinical language struggles to name. The physical process of dying in Stage 7 most commonly involves swallowing. Dysphagia, difficulty, swallowing, develops as the brain progressively loses its ability to coordinate the complex neuromuscular sequence required to direct food and liquids safely into the esophagus rather than the airway. Despite skilled, careful feeding, thickened liquids, pureed textures, patient technique, aspiration events eventually occur. Aspiration pneumonia develops. It is the most commonly documented cause of death in people with Alzheimer's disease. The person does not die from Alzheimer's directly. They die from what Alzheimer's has made impossible, managing the body safely in its final and most basic functions. For a loved one, the most important thing any family can do before reaching Stage 7 is to have had the conversation during Stage 4, when the person could still fully participate, about what level of medical intervention they wanted. Advance directives, healthcare proxy designations, comfort care preferences, these are not paperwork. They are a gift given in advance. They mean that when Stage 7 arrives, the family can focus entirely on presence and comfort, rather than making irreversible decisions under acute crisis. Comfort-focused care in Stage 7 is not giving up. It is not failure. It is the most informed, compassionate, and medically appropriate response to a disease that has reached its final stage. It means managing pain. It means careful, dignified physical care. It means the person's experience, as much as medicine can influence, is one of comfort and not distress. Breathing becomes irregular. The family is there, and then gradually, the person is not. You have just walked through all 7 stages. Most people who receive an Alzheimer's diagnosis today will experience stages 4 through 7 because they were diagnosed after the earlier stages had already passed unaddressed. Most of them were in Stage 1 for 2 decades before a single symptom appeared. Most of them had modifiable risk factors that were never addressed during the years when addressing them would have made the greatest biological difference. Here is what the research says. The 2024 Lancet Commission, published in The Lancet, one of the world's most respected medical journals, concluded that approximately 45% of dementia cases worldwide are potentially preventable by addressing 14 specific modifiable risk factors across the lifespan. Nearly half of all cases. Not through pharmaceutical drugs, through choices made primarily during Stage 1, during the decades when the biology was still most responsive. Sleep quality directly affects how efficiently the brain's glymphatic system clears amyloid overnight. Every night of insufficient sleep is a partial failure of the brain's primary waste clearance cycle. Physical activity supports hippocampal volume in adults over 60, not slowing the loss, in some studies actually reversing it. Managing blood pressure protects the blood vessels that supply every neuron in the brain. Getting a hearing evaluation when needed and using hearing aids reduces the cognitive overload that accelerates tissue loss. Maintaining genuine social connection stimulates the precise brain regions most vulnerable to Alzheimer's. None of this requires a prescription. Pharmaceutical companies have spent decades and billions developing drugs designed to treat Alzheimer's after it has developed. The lifestyle evidence that addresses it before symptoms appear has existed in peer-reviewed journals for years. It is simply not what gets discussed in a standard 15-minute medical appointment. That is exactly what this channel exists to change. Here is what to do after this video. If you are watching for yourself, make an appointment this week. Ask specifically for a MOCA baseline cognitive assessment, a blood panel including B12, thyroid, and HbA1c, and a direct conversation about your Alzheimer's risk. Ask for these things by name. If you are watching for someone you love, share this video with every family member involved in their care. Understanding which stage the person is in changes how you support them. That understanding is worth everything. One question in the comments before you go. Which stage made you stop? The one that made you think of yourself or of someone you love? Just the number. Stage 1 through stage 7. I read every comment, and the answers shape what comes next for this community.